Good afternoon. I'm Isabel Estrada. I do communications for the Office of Behavioral and Social Science Research. I am looking to see who is the note taker that will make me speak in full sentences after the... Those are very important people in meetings like this. Well, it's a great pleasure for me to be here. It is an honor, and I am really actually quite excited to be moderating this panel. And I will just say one thing. When we were considering how to organize this meeting, we really wanted to pay a lot of attention to giving good examples of career paths for what we keep calling the future of the field, etc. But we also want to have sort of a thread, something that explained or at least gave a good showcase of all the areas, our own priorities, etc. The more I go through the program today, I think, okay, we didn't do half bad, because several of the people that have already spoken, and you will see the couple of treats we still have for you, actually their work connects seamlessly, as if we had done it on purpose, which we obviously are, we are taking credit for it now, but it's, you know, all of you have organized a meeting or two. Not everything was planned as it might seem now. Well, again, Isabel Estrada, and then you have, as Bill would say, you have the bios for all our distinguished panelists, but we will start with Nabil El-Gourouri, Associate Executive Director of the American Psychological Association of Graduate Students. And
okay, great. Thank you very much for the invitation to speak. Okay, so when I was reviewing my slides just a couple minutes ago, I noticed I had forgotten to put my name up there on this slide. So someone corrected the slides too. So I'm very appreciative of that. I am by training a clinical psychologist. So I have my PhD in clinical psychology from Binghamton University. And my area of interest when I started graduate school was autism and applied behavior analysis in particular. And then as I developed in my career, it expanded more to disruptive behavior disorders, and so I tend to see primarily boys in my clinical practice when I was working, and then also bilingual services. I'm bilingual in Spanish, as is obvious by my name. No, I'm part Egyptian, but I'm also Nicaraguan, so I speak Spanish too. But my career trajectory, so now I'm here at the American Psychological Association. And so I had a very circuitous route to getting there. I did a postdoc in autism at the University of Rochester, and I had left autism because I worked with, in my graduate program, I worked with a really bad advisor who was studying there. I friendly call him Voldemort now. So I left autism to go into disruptive behavior disorders, and then I went back into it for my postdoc, and I hated my postdoc the first day I was there. But I learned a lot in that postdoc, so I never regretted that. And then I ended up, after that job, at an academic medical center doing pediatric psychology. This was at Case Western Reserve and MetroHealth Medical Center in Cleveland, Ohio. And I was supervising psychology grad students. I was precepting PEDS residents in a rotation in their residency program. And I actually led a pediatrics rotation. I also saw lots of patients. Half my clients were Spanish speaking, so there were some days I didn't speak English. At the same time I was doing all this, I was heavily involved in organizations, primarily the American Psychological Association, the one I am hired by now, and then also the Ohio Psych Association. As a grad student, I'd gotten involved in APA, and I'll tell that story in a second, or later on what I learned. And then at APA now, I'm the director of the graduate student group within APA. And so we do a lot of things. We do a lot of activities at our annual meeting. We provide a lot of resources for graduate students. And then my job is really to be an ambassador for APA to students, and then to be an advocate on behalf of students within psychology and within our association. So I am always thinking about the implications of actions that APA or state governments might do on students. Okay. So I'll talk about my on-the-job experience from this current job. Really, the biggest thing is organizational processes, really understanding how organizations work. APA is a huge nonprofit amongst the association world. We're about 620 employees. Learning a lot about advocacy, about education and training requirements. I have learned way more about accreditation than I ever thought I would know. And social media, I had just joined Facebook before I got this job, and today I'm live tweeting the session. I actually tweeted a photo from right here while I was sitting. I took a photo of you all, so you're on Twitter right now. I also have done a lot with leadership development, because part of one of our missions from APAGS that the students developed was leadership development. So I've been training, so part of my job is to train these students to become leaders, to become effective advocates. Executive management and dealing with difficult staff was probably the biggest transition for me. I had always worked with very collegial folks, and it was hard to come into a situation where there was a little more tension at times. So that's been a really big skill that I learned on the job. And then marketing, grant development, writing. I feel I'm a jack of all trades in my position, so I'm never bored. That is for sure. I'm never bored. And these are my students here that I have down below. Catalytic career moments. So I grew up with a brother with autism. And so that is why I'm in psychology. That's why I study autism. And that's why I continue to be an autism advocate. But then I also was very interested in politics. I joined debate in high school. And that encouraged me to really speak my mind. But I would also say how I've looked at my current job is that I'm doing the politics of psychology. So it's been a nice meld of the core interests that I've always had in my life. I went to UCLA, and I happened to, I was a psych major there because I wanted to study more about autism. And it just happens to be that there was a great researcher there, Ivar Lovaas, at that time, the leading expert on early behavioral interventions with kids with autism. So I got to do clinical work with him as an undergrad. So I was doing one-on-one behavior therapy with kids with autism in their homes, playing with them and teaching them. And then I got to supervise students in that role. But then I also was funded by some grants to do research with him and with a grad student. So that was a really good opportunity. That really sparked my real interest in research in autism and in psychology. And so in grad school, while I was working with Voldemort, the director of my program called me into his office. And for those of you, how many are still here in graduate school? Are there any still in grad school? Okay, a couple. So getting called to your professor, the director of training, or the chair, is usually not good news, right? So I was very scared. I was like, what do you want to see me for? And he said, I saw an ad in the magazine that the American Psychological Association of Graduate Students is looking for someone to they're looking for leaders, and I think you should run for chair. And I was really surprised, wow, and I was very flattered, and I asked, why do you think I should do that? And he said, the person who does this is going to change the field. And wow, that's, thank you very much. I really appreciate that. So I actually did run, and I lost. But then I ran the second year, and this is before Facebook, right? So I had managed to have a pretty big network of people, so that former undergrads that I worked with and people from my undergrad career. And so I ran for another position the following year, and I won that. So I became member at large. And then after that term, I was chair of the LGB committee. And so during that time, I got to serve on the task force that updated the ethics code for psychologists. So that was really cool. And so that ethics code was really interesting because I ended up working with 3 future APA presidents. So like I walked into a room with like all the people who are doing stuff in my field. And I imagine it's how other things like the DSM and other major things are created. It's a room of people talking and deciding things. And I had to speak my voice to advocate for student issues. Let's see. One of the other things I think is important is before I got this job at APA, I had wanted to move to San Diego where my brother is and where my parents are, and I didn't get a job there. And I was very disappointed. I was like, oh my gosh, how am I gonna get back to San Diego? And a month later, the job that I'm at right now opened. And so I realized, like, this is the job I was meant to do. I'm really lucky doing this job. Oh yeah, and I got loan repayment. That makes a big difference in your ability to change jobs. Thank you, and National Health Service Corps. But I guess NIH has their own loan repayment, so you might be able to get that. What I wish I knew at your career stage is definitely follow up with people that you meet after conferences. Now it's so easy with LinkedIn and email. I would link in with everyone I meet at a conference. I said before, sometimes the best training opportunities are the ones you dislike. So I learned at my postdoc the characteristics that I wanted in my future jobs. That job was very much a traveling salesman kind of job, a consultant, and I realized I wanted center-based work, so I looked for places where I could sit around stand around a water cooler and talk about the last episode of American Idol or Game of Thrones or whatever. Let people know you're looking for work because you never know who knows if a job is open. I would say professional worlds are incredibly small. So do not burn bridges. Do not burn bridges. Let me repeat. Keep these bridges alive. Not only don't burn bridges, keep them alive. That's what the LinkedIn is for, email, seeing people, particularly if you're in the same city. In organizations, the personal is very political. So building relationships are so important for getting things done. And I didn't know that, but I was pretty good at it as a grad student, but I've learned that much more in my APA position. And like I said, you never know how things will work out. I personally believe things work out for a reason. If you don't get a job or if you don't get into the certain grad school or postdoc, hopefully there's something better out there for you. And then finally, it's okay to change your focus. I was a psychologist in practice for my first 7 years. I am in my beginning of my organizational work. And at some point, I'm going to change again. I'm sure I'm going to, I'm getting ready to look for the next position or the next stage of my career. So it's okay to change. That happens and evolves as part of your career. So you could find me. You could follow me on Twitter. Dr. Nabil is my hashtag. You'll see a lot of everyone's in photos on there. So feel free to LinkedIn with me if you want. Okay. Thank you.
That's good.
Now we'll hear from Dr. Joe Gile, and this is one of the cases in which I said that we have apparently planned even better than we knew, because we didn't know that the work of some of the ESI winners will be so connected to the work of Dr. Gile, and he was invited before we knew who would win the competition. So.
Well, I'm very, very pleased to be here, and I don't know, when I was asked, I thought, well, how hard could it be to sort of talk about your career, although it's not something I'm really used to doing, but now I'm not sure if I'm here as a good example or a bad example. But
we needed both, though.
Huh?
We needed both. That's sort of what.
Thanks. Yeah, so I'm a physician. I trained clinically in family medicine and did that for many, many years. And I guess I think of my career and trajectory in terms of people I met. And I guess I would really echo some of the things I've heard earlier about mentoring and the importance of mentors. I, too, was in the National Health Service Corps. I was the only physician in a little town in West Virginia, New Haven, West Virginia. I guess I could have started the Yale Center on Aging in New Haven, West Virginia. I was on the faculty at Hopkins and was the project director for the NIMH's ECA project in 1994 when we went back to re-interview people who had been interviewed in Baltimore. I trained I trained there and did a postdoc in psychiatric epidemiology, in part because I met Jim Anthony and Bill Eaton, and I thought, gee, however these guys are thinking about mental disorders in the population really does apply to sort of primary care. And I mean, family medicine primary care is like it's like a survey of the population, except the respondents come to see you instead of you going out to them. And I was very honored to have, for many years, a K-24 from NIMH for mentoring, and did a number of projects, one of them the Spectrum study focusing on depression in late life, and that's been something I pretty much have stayed focused on. Actually, I was thinking that where did that start from? And that actually goes back even before what I'm going to show you on my training and formal, informal training, which was that I met an activities director in high school and worked in a nursing home, and we did the activities there. She was so positive about aging. It really got me quite interested in aging. And now also the connection with OBSSR is I'm the PI for a mixed methods research training program. We just last week did our second training in Boston of 14 scholars, so far 28 scholars from a wide range of fields, really. And I have a picture of William Welch there. He was the one of the first faculty members on the School of Medicine at Hopkins, also the first dean of the School of Public Health. And it's to remind you that it's also good to read about people, read people's biographies, et cetera. I mean, Welch really was a visionary. He was thinking about public health, at a time when people thought public health was microbiology. Here's a guy thinking about mental health, nutrition, what should be in a School of Public Health. I think it's really a fascinating, thing to read. So I have there also listed under my informal training, my postdoc, because I only took one course. The rest of the time, Jim Anthony said my job was to read. I never had a job like that before, and learned a lot of statistics there, and then like to think of my career in terms of being at Penn. I say that I did a 10-year sabbatical at the University of Pennsylvania, and hanging around with medical anthropologists, which led to this interest in mixed methods. But I think the idea of mixed methods, that is, not just sticking with a quantitative paradigm, but also linking it with hearing things from people in their own words, among other methods, seems particularly important now when we're interested in things like adherence, implementation. Why don't practices do what we think is evidence-based? And the need there to cut across cross-disciplinary boundaries, I think, is very important. Excuse me. And I could talk about that more. I have the question there: cross-disciplinary boundaries, courageous or foolhardy? And maybe it depends on the stage of your career, but we all can tend to get socialized in a certain way that doesn't allow us to really look beyond that to ways that we might be thinking innovatively and creatively about solving the problem that we face. So I've organized my catalytic career moments in terms of people I've met who influenced me. And the first set was the MPH at Hopkins, because I met Jim Anthony and Bill Eaton. They changed my whole career, because then I wasn't even going to apply for the job of project director. But I was encouraged to do that after a national search. It led to a lot of things, including me linking what I had seen, what I thought I was seeing clinically, where you think someone's depressed, but they don't think they're depressed. How do you manage that or think about that? And then at Penn, I met Fran Barg and also Tom Tenhave. Tom Tenhave was one of the most premier biostatisticians in mental health, who unfortunately died at a young age, but was just an outstanding mentor and scientist. And so we had a number of things that came out of that related to mixed methods, and began to focus on more aspects of depression. And then also, I've participated as a mentor in ARI, which is an NIMH-funded program of sort of distance mentoring, and so I've done that going on for over 12 years. And it's been an opportunity to learn different ways that people mentor and different strategies, and just the fact that it might not be true that everybody can really mentor people. So what I wish I knew at your career stage, or some things might be just as well that I didn't know, I think. Medicine as a career has sort of taken me a lot of places, especially when you have no roadmap. I don't come from a medical family. My parents did not have a lot of education. So I sort of went into it not knowing really what to expect, and driven more by curiosity, I guess, than anything else. I do take note of the sinusoidal wave of despair and elation. And what I mean is that sometimes I tell people, you can be very critical of your own work. And I find that when I'm, particularly for a grant, since it's such a big deal, you think of it and you say, wow, this is really great. And then as you're working on it, you think, boy, this really stinks. Everybody has done this before. And then maybe you get some feedback and then you're kind of into it again. So now I don't let that discourage me from moving forward. I just think, okay, I'm on the sinusoidal wave of despair and elation, and I'll just keep plugging away till it goes in. That's why there are deadlines, I guess. Do your best to steer clear of negative people. Sometimes if your things aren't working, it might not be you. Sometimes there's as someone at Hopkins told me, there's a gene environment interaction that's sort of like not in your favor, and in those situations, it's possible you might have to move on. Plan ahead, but not too far ahead. Things happen, and you want to be sort of prepared to take opportunities. And I would say, try to keep your balance. What I'm showing in the pictures here at the bottom, that's the first cohort in the OBSSR mixed methods training program. They're from all over the country. And we're trying to, we're keeping in touch with them. We're working on several papers, actually, related to the project and try to look at sort of the outcomes of that. Those other guys are my 3 children. So I kind of feel like, my career is very important, but I've been able to, stay in touch with them, and they're pretty nice people. A high school teacher, a medical student, and a Cambridge student who's been spending the last year in Africa. She's going to be returning soon. And then the little guy is brand new, first grandchild. So how to find me? If you put in mixed methods training in Google, the website for the training program is actually pretty much the first site you'll come across. And you can read a lot more about what mixed methods is and the faculty and things like that. And I have a character flaw where I want to talk to anybody about anything, pretty much any time. So I don't know. Do I have time for one short story?
Okay,
So I was debating whether I should tell you this or not, but I'm reading the book Gene, by the guy who wrote The Emperor of All Maladies. I forget his name, Mukherjee, I think. So, but I noticed he had this This is really true. This is in the book. He says that, there's a lesson in here too somewhere, but let me tell you the story. So Gregor Mendel wanted to study heredity with mice. And the guy who runs the monastery said, you know, he didn't want him breeding mice in the monastery, but he would give peas a chance. So listen, thanks. With that, I'll leave you. Yeah, thank you. Thanks.
By the way,
She's stunned.
By the way, actually, the Mixed Methods page is the page with the highest number of clicks on our
yes,
website
right.
still. So we
Right.
might have to update that.
Right.
Just a plug there to future
Yeah,
work.
good.
Okay, so, and now we have Deborah Kestel, and she is from the unit chief from the Pan American Health Organization in mental health and substance abuse. And I am particularly honored to have her here. The Pan American Health Organization is one of my fave organizations, but also I think it's really important to get a sense of other opportunities outside of, you know, academia in here, organizations in here, government here. No, let's see what opportunities there are out there in other countries working with international organizations like this. Deborah, thank you.
Thank you. Thank you very much. Thank you for this opportunity of being here. I was reading all the time this line down here that says real life, labs, research, and I think I'm coming for the real life part of it. I've been, I think, once or twice in a lab, and my research is involvement, direct involvement is quite limited, so I warn you. Another thing is that you already have noticed I'm not from this country. I'm from Argentina, and I have probably a Latin influence when writing, or I'm the oldest, I don't know, because I have written a lot of things that I have done everywhere. So I keep the track of the time in order to avoid speaking too much. So in terms of formal training, other than some initial interest for law studies, I did my main studies in psychology. In Argentina back then, psychology were 6 years. And the title is not existing anywhere. It is Licenciatura en Psicología, and is equivalent to a master's. When I went to do my first master's, I learned that I had already one, and I didn't know. So yeah, that was great news, actually. And although I don't think I ever practiced as a psychologist, I have two main issues that I studied during those years that really are defined my career. So I think it was a great experience I had. And then I did a master's in public. Well, I did some courses in health system and services, and then a master's in public health later on. As it was mentioned before, it's interesting because you listen to all the presenters and you find yourself here and there, so we are not that original after all. Somebody said, I don't recall now who, that you do your studies, you touch the real life for a while, and then you go back to study, and then the second time is going to be much more powerful, useful perhaps than the first one, no? Because you know what you are looking for. In terms of the career trajectory, and this is where you see that there is a lot written, and I tried to summarize it, but it is also due to the fact that I've been moving a bit around the globe. And I started, and this is again really what marked my career, as a volunteer at a mental hospital in Argentina, and a mental hospital of 3,000 people back then. I then moved to live in Italy, and in a place that was known as one of the best examples of development of mental health services at community level. And I was working with severely mentally ill youth, a big group of between 30 to 40 people with severe mental disorders, and that's where I learned what what really mental health was and what kind of answers you needed to have in the community in order to help those people to live in those communities. I then had a short experience working with elderly, always in the mental health context in Italy. And then I had this privilege of joining a team that was working in another city in Italy, in Udine, in a deinstitutionalization process. The experience and the well-name of Trieste has been around developing, as I said, mental health services at community level 40 years ago. And then some areas in Italy were still with all institutions, so I could go with the most expert people around, I would say also around the world, to do this process in another city and to learn what requirements are needed in order to change the organization of public health services and systems. I had then the opportunity to run as a mental health head of psychiatry sector, an NGO working in those services in a couple of cities, managing services with mentally ill with people with severe mental ill conditions, and I found myself suddenly supervising 190-something people was the last time I counted them, and then before I ran away from that job. And then, yeah, because it's kind of something special, no? And then I had this great opportunity of being sent from Trieste to Cuba after a hurricane to provide some technical support to the affected areas there, and then the opportunity to realize the richness behind the international cooperation. It was really a discovery that while I was trying to give my best to help people there, I would gain a lot of expertise and a lot of energy also to bring back home and continue my work with renewed energy. And then in this context of realizing that that's what I want to do when I'll grow older, and I was already quite old, it was that I was sent to a project in Kosovo after the war, and it was a project run by WHO, and so I ended up being a WHO person. I then moved to Albania, I ended up being a head of the WHO in Albania, meaning out of mental health and into a broader responsibility. And then I was, after 18 years living in Europe, I said enough of Europe. I want to go back to my region, and I ended up not in my region, again, not speaking Spanish. I never worked in Spanish for all those years. I improved my Spanish since I'm here in Washington, D.C. And I ended up in the Caribbean, working for the regional office of the Americas, that is PAHO, the WHO regional office of the Americas. And so I've been working for a few years there in the Caribbean, which is fantastic, not as I imagined that it would be, that I'll be in one ship moving from one island to the island, to the other. Is not that nice. It's hard work, but it was a great opportunity to change the perspective of the needs of a country. I moved then, I resigned again and moved back to Morocco to follow my husband, and I continue working as a consultant, always for PAHO WHO. And then 4 years and a half ago, I came to the headquarters of the Pan American Health Organization here in DC, and it's a year and a half that I'm in charge of this program. It's long, huh? I have no idea. I put this timing, but I'm not sure. I spoke a lot, huh? I'm not going to go through all this because you can have it and see it yourself, and it's going to be long. But I learned, and it was also mentioned, you know more than what you think you know, and you if you're smart enough, not that much, just enough, you will learn from each one of those experiences, and you will acquire knowledge and ways of doing, and you will assimilate things that work good for others, and you will incorporate them. Then, of course, you do some courses and training. I learned a number of, I have considerable expertise in a number of areas around mental health in general, including something on substance use, alcohol, but from dealing directly with severe mentally ill and families to service organization. Then you need to plan and budget for that. Then you need to supervise, as I was saying before. I'm still supervising not 100 people anymore, but a small team. One of the richness, I think, of this kind of work is the multidisciplinary and multicultural environments, because it really changes your mind, the way you see things, the way you are open to diversity, and the way you accept diversity, and how you can process new information. Working, of course, with local authorities, how do you understand that the way you think things need to be done not necessarily represent what other things, because they have other challenges and needs and experiences that you may not be aware of. So how you establish that dialogue. Post-conflict, emergency, of course, an entire different area. Donor coordination or partners coordination, networking in general. Scaling up and scaling down, tailoring cooperation. You can't absolutely have one scheme of how things need to be done, because then it won't work. You have to be able to adapt your knowledge and your expertise to the needs that are in front of you. I'm done with it, science. Indigenous communities, users and families, and something that was mentioned in the first, the colleague from the Montgomery County, intersectoral work. And that is something that you learn really with time. You move from the narrow thing that was also mentioned before to a broader perspective, because if you stay there, it is hard to achieve results. Catalytic career moments. I'm going to go fast. I'm sorry. I didn't say that I learned 5 languages in the meantime, also in those learning processes. Career moments, graduation in a faculty that was closed by the militaries, and we need to fight in order to open up. So from the very first day of my career, I learned that if you want something to happen, you need to fight for it to happen. When I first went to the mental asylum, I couldn't believe that people were living in those conditions just because they had a health condition. And this is valid whether they are in a mental hospital, in a jail, or in the street. It is so unfair that it was what shaped then my career. I went to Trieste, and I found that those same kind of people with the same kind of problems were citizens in a society, functioning as much as they could, as much as they want. And that was, again, definitely the change with my first experience in international job in Cuba that I mentioned before. The deinstitutionalization I also mentioned. See, at least I already said some of the things. And the main issue when I joined WHO was that I could realize that I had the possibility to affect, to influence governments that will affect the life of people in better, hopefully. And that is definitely the most powerful things. The things I wish I knew at your career stage, that was the hardest slide to do for me. I think that you just have to go step by step and follow your guts. And whether you change or not, as it was mentioned, career, if your guts are telling you that you are doing what you believe in, you will do it well. I think that's the main thing. Then experience only comes with time. Partnerships, integration, that's really something that we don't pay enough attention probably at the beginning. And then, as somebody mentioned also earlier, I wish I wasn't taking everything so seriously. I mean, I worked very hard. Great. I had a fun life. I still have it. And I worked very hard. Sometimes I wondered if It wasn't too much. And these two pictures, there's a lady that's the leitmotif of my career and my efforts every morning when I get up, is moving people from this condition to that condition. That is the same person, of course. And how to find me? In these pictures, you can find me, but also there. The first picture is my team with a group of kids from autism school that are doing internship at PAHO with us. Users and family, mental health services users and family relatives, a meeting I'm very proud of. And my last meeting last year, the last was last week, but the biggest one last year with 29 countries of the region represented, including the US. Thank you so much. Sorry for the time.
And now we have Dr. Suzanne O'Neill. Again, to continue the thing of the thread along the meeting, we interviewed after we had invited her. We interviewed her because all of a sudden we noticed how much her work and Dr. Lerman's work were similar, connected, etc. And we interviewed her, and she says, "Oh, all of my work flows exactly from Karen's." And I said, "Okay, I guess we definitely know how to connect people."
So thank you. Thank you, Karen. So I think my path may be the most traditional of the speakers so far. Maybe I'm like the lab leader, lab PI, but I definitely took a circuitous route to get here. So before I went to college, I actually knew I wanted to be a psychologist. My science fair experiments were in learning and memory. And I started learning statistics from a PhD zoology teacher, which was one of our science teachers. But like Dr. Kelly earlier noted that there were only certain careers that were okay to go into. My parents did not understand what I would do with a psychology degree. So I started off at Notre Dame as a pre-med major that lasted a semester. And once I got in and they were paying my tuition, I changed my major and graduated with a degree in psychology. I went on to the University of Illinois thinking that I would finish my PhD there. I found out probably within the first month, originally from Philadelphia, that I did not belong in the Midwest. So I spent 2 years there and got my master's and worked for 2 years at the University of Vermont before going back to graduate school and got my PhD from Delaware. I did my clinical internship at the the Medical University of South Carolina in behavioral medicine, and then had 2 postdocs before I started my faculty position. So I started at Georgetown in 2008, where I've been ever since, and got a series of grants, smaller grants leading to larger grants, and then I will be tenured as of next month, as long as I can behave myself. So just through the end of June. Just have to watch what I say, I guess. So when I think of the on-the-job achieved expertise, I think of, I trained in a really traditional clinical psych program, started out thinking I wanted to work on anxiety and depression and how stress and coping processes and affect regulation impacted developing anxiety disorders and affective disorders. But then sort of found over time that my interests were more in the behavioral medicine, health psychology area, and started to inch my way over there. And so the things that I needed to learn moving from clinical psych over into what I do now, I needed to learn a lot about oncology, so the process of cancer treatment, and there's a lot involved in that as far as what's the biology behind these treatments that the patients I want to work with are receiving, and kind of how does cancer behave. I had to learn quite a bit about public health. What I do kind of bridges clinical and public health. Learn about the processes of clinical care. And so as people are kind of going through cancer treatment and talking to their doctors, what is that process like and what are the gaps? I had to learn, a lot of my work is in genomics, so I had to learn a lot about somatic and germline genomics, tumor biology, health behavior theory, behavioral interventions. That was not part of my training. And then just as my career kind of moved along, how do you put together a manuscript? How do you put together a grant? What is it like to be on a study section? What is it like to do human subjects research? Some of what I was doing was not human subjects research. And then as I've move on to lead a lab, what is it like to supervise your staff? And what is it like to, it's hard for me sometimes to delegate to other people who work for me. And so what is it like to, kind of multiply your efforts by, having a really great staff that works for you? How do you lead multidisciplinary teams? So when people do speak different scientific languages from you, how do you kind of lead them to work together on larger problems? And then how do you move from being someone who is mentored to someone who now has to mentor other people and kind of bring them into the path? And so when I think of career catalytic moments, a lot of it I think kind of happened, sometimes by mistake. And some of the most important things were kind of happy accidents, I think. So my undergraduate institution at the time did not have a lot of NIH-funded research going on for us to become involved in. But the project that I started working on was on child depression, and I was working with my mentor at the time, who had his first NIH grant and has now gone on to have many, many other grants. But to kind of be involved in that process of implementing a grant at such an early part of my career, and to really see, he was really a wonderful mentor in that he involved this large team of undergraduates to the degree that we wanted to be involved. About selecting measures and implementing the studies. All the data were collected out in elementary schools in South Bend. So going out and doing different types of data collection, using different methods, and then how do you then bring the data back in and analyze it. And if we wanted to be involved in that process, we were able to, which was a wonderful learning experience. A big thing, deciding to leave a graduate program that I was probably 22 at the time when I left there, and my faculty had said, well, you'll never get back in. Like, you don't leave a graduate program. It's like, you'll never get back in. It's like, well, I don't want to stay. So I left. And I think it was probably, it was certainly a life-changing experience for me because I would have a completely different career than I do now. And when I left Illinois, and I moved to Vermont because my husband was finishing medical school there, and I took a research assistantship in behavioral pharmacology. I didn't know anything about behavioral pharmacology. But the lab that I worked in was the lab of Steve Higgins, and had a kind of a basic behavioral pharmacology lab, and then also a clinical treatment center. And so to be able to see how the work that we were doing, I was more on the lab side, but to see how those two pieces interacted and what a large grant-funded research program looks like was extremely valuable for me. Having conversations about how the stress and coping research that I was doing in graduate school might relate to the area of genetic testing, a lot of which is what I do now. So this is back in 1999, and this is where the work that Karen has done over the years. Before she did all of the work she talked about today, she also helped to really found the work that I'm doing now as far as how do individuals and families respond to genetic information. And that kind of led me to shift my focus. And it was really important at the time, so the graduate mentor that I had at Delaware, rather than wanting to, someone said, your graduate mentors want to shape you in their own image. He did not want us to do that. He wanted each of us to be our own individual and create our own career paths and not be his clone. And so he said, well, as long as you are continuing to do all the work in the lab, sure, you can go do all of this extra training in genetics. And so that's what I did. And then, again, shifting from a traditional clinical psych program into behavioral medicine, I needed to get extra training, extra clinical practica to kind of move that direction over. And so it probably took a little bit more time to kind of land where I wanted to, but I started getting there. And then I had two really stellar postdoctoral positions with really wonderful mentors, with a lot of support and funding to be able to do research projects that I was really interested in. And it was extremely helpful for me. As far as lessons learned, I think, pursue your true passions. I probably could have avoided a lot of stress my first semester in college had I just started off as a psychology major, instead of doing something that I didn't really want to do. And I think, increasingly just kind of like listening to, what is it that I really want to be working on? Not necessarily the thing that seems obvious, but, pursue the thing that seems like, this is going to be the most interesting question and what I really want to do. I think like one of you just said, trust your gut. If seems like it's just not going to work, or that this is not a good group of people to be working with, don't do it just because it looks good on paper or it's the direction that you're supposed to go in. So always try to think ahead, but also in the moment. I think I have a tendency to kind of think in kind of 5 or 10 year trajectories, but not really focus on what I'm kind of doing at the moment, and kind of the pleasure and the interchange of working with my colleagues. Ask. So I think a lot of the most important moments in my career and the different directions I've been able to go weren't posted jobs or weren't opportunities that were obvious. I had to, thank goodness for email. I guess what would have been cold calling people or writing them letters. But with email, I could just email whoever I wanted to work with. So that's what I did. And usually they would say yes, and it would be just the right thing that I'd be looking for. So sometimes the best opportunities aren't necessarily obvious. And now as I grow my work, looking for new collaborators, looking for different populations to work with, you really don't know without asking. It could be a partnership that other group was really looking to start to develop as well. Again, I think echoing what someone also said, it's a small world after all. That I think as you go through your training, I think you have to continue to build bridges, don't burn bridges. Even if something isn't necessarily exactly what you want to be working on, be respectful and try to learn what you can from that, because you never know when that may turn around and be helpful. And also working with your junior colleagues as you advance, to build good relationships with them. Many years ago when I was at the NIH, there was an Erda who worked at the Genome Institute. She has now gone through graduate school, and she is a postdoc on one of my projects out in Seattle. And so to have that previous relationship and friendship and know what a good scientist she is really helping my project, a decade later. So it all comes back around. You can get mentorship from many sources. Not everyone is going to be an exact fit for what you need at whatever particular time of your life. They may not, look like you or sound like you or have much in common with you on the surface. But everyone has things that you can learn. You can learn, how to manage your work and family life from some people. You can learn about how to manage your lab from others. You just kind of have to see kind of what you need to learn and who can share information, or perhaps even show you what not to do. Try to take criticism constructively. Often, unless it's completely off base, there's often some kernel of truth in what people are trying to tell you, and just try to kind of put that into the scheme of kind of how you're thinking, and it may be tough criticism. But I think it's good to process that tough information. Be a good citizen, so whether that's a collaborator, a boss, or a mentee, for all the mentorship that other people might offer you, be a good mentee. If someone offers you to be a co-author on a paper, be that good co-author. Work through drafts, work through opportunities. Don't let those opportunities just fall fallow. And then also learn outside your expertise. I kind of think of what I do is like if you kind of think of a social network, kind of what's the interrelatedness? What are the other disciplines that relate to what I'm trying to study? Because that's probably where the interesting questions are. And then how to find me. It's just literally right up the street. Thank you.
Well, thank you all the panelists. If we have questions from the audience? Well, I have a couple of questions to start off. And let's start the same direction, the opposite direction. I had a question precisely about almost your last sentence, the issue of working across disciplines. Susan, how do we train new or young students, graduate students, etc.? I think it was Dr. Gallo who had a funny thing about is being cross-discipline smart or actually silly or something. And it's that. I mean, I know it sounds really good. Everybody says, okay, you should have all of that cross-experience. But then when it is in a resume and people who are hiring look at it, they may see it a little different. They may see it as lack of depth. However, you, as you were saying, and as I was reading your own research, you have had to learn from a very broad breadth of different of disciplines. So, what advice do you have in that regard for?
Well, I mean, I think, as you're going through your training, I think it's important to, first establish your expertise in your core discipline. I haven't seen a patient in 10 years since my daughter was born. I'm still a licensed clinical psychologist here in DC and in Maryland, and that's still my core discipline. And I think how I come at my work, I still think like that. But I think that to be able to understand, with the applied work that I do in health and in cancer, to be able to understand, what is it that an oncologist and a patient are talking about. You have to have some understanding of perhaps the types of treatments that they are discussing, and how burdensome are they, or how complex are they, and so why might a patient not adhere to their treatment? Well, if you don't understand, how hard it is to go under those treatments, then you're not really understanding kind of the richness of the patient's life or the complexity of what the oncologist has to talk about. And so you don't have to be an expert in all of those things, but to be able to put your own work in that broader context, you have to understand, good bits of it.
And pressing that point, just one more nudge. Is that how you train currently your students, your graduate students? Is that something that we are putting as a major thought in the current training of the students?
Yes, I mean, I think I try to emphasize, with the people that I work with, to not view things, in a bubble. Just because we may be more interested in the psychological processes, that you really need to understand and provide reading and provide opportunities to go to different types of conferences or to go to tumor boards. There are different places to get different sources of information as you're training, and that you should be seeking those out.
Thank you. Deborah, your experience is a lot different than most of us at the panel right now. Perhaps could you just say a couple of words regarding how the training is done abroad, and how do you work from here with, say, in this case with Latin America, although you have worked pretty much all of the PAHO's regions, of WHO's regions, but can you say a couple of words in terms of how you work with professionals across the...
That's a big challenge, because the training in most of the countries of the region is outdated, majority of it. I mean, there are, of course, exceptions of good models and practices, but in many countries, people are trained today as they were trained 30 years ago. And precisely yesterday, I had a call with some colleagues. We are trying to organize a meeting with university specialties in psychiatry or family medicine, to see how to convene those people and with messages that will change the training, the way we keep training people that come out of school, and we do some training after through the ministries of health and so on. And you say, till when are we going to do that? The schools should change, and that's I think is sometimes harder to change those systems than the heavy bureaucratic health systems in countries. And I see some nodding around, but that's something that you see a lot around. There is a lot of resistance for new things.
And Dr. Unless somebody else has a question. And Dr. I wanted to just press a little bit more on the same issue of interdisciplinarity and how are we teaching that? How, and this comes a little bit from some of the work we are doing right now and working with younger people, and honestly, that is part of what this event is put together. We really have an interest in pushing. So could you discuss a little bit more? You had that word of wisdom of if interdisciplinarity is foolhardy or...
Right. Foolhardy or courageous.
Yes.
Right. It does get at the crux of, for example, the mixed, I could put it in the context for the mixed methods training program, because that is a challenge. You have people from different disciplines, and I guess, and there it's maybe very explicitly sort of frequently people come with, they have statistical background, and they're not used to qualitative methods, or they reduce qualitative methods to focus groups. And so part of the value of having that group is, in fact, that you can bring people together to talk about it. And what I think can, in that situation, kind of wins people over is the focus on the problem, that these problems people are dealing with, public health, as I mentioned, adherence, et cetera, they have been intractable problems. And, or you're dealing with different cultural groups. How do you understand the intervention? So we're, in the mixed methods training program, we really do try to deal with that and talk a little bit about teams and leadership of teams for approaching those. And I should say that group of scholars, they are not necessarily people who are just starting out in their research career. Some of them are maybe you might call mid-level career people in different areas who want to get that extra training or thinking around deploying a multitude of methods. So I think it has to come from the person who's leading the team that models the respect for the different groups that are at the table.
Thank you. And Elgori, I had a different question from you as the rep of the graduate students here. What do they complain about? What do they think in terms of, I mean, not the long list, just, we are against the clock here, so it's just the, seriously, in terms of training, and particularly, obviously, you are from the APA, so in terms of training, what do they think they are lacking when they are going out and trying to, pay for all of those student loans?
I think the biggest issue facing PhD students right now is the lack of tenure-track jobs, and related to that is the increasing tightening of research funding for scientists. So that is a big issue. We're training too many people, and there's not the jobs out there, and there's more and more experience needed to get those jobs. And the perception that doing an alternative career is a bad thing. I mean, it's pretty much, the joke in my program was you had to say the lie to get into grad school, that I want to be a professor and have a small practice on the side. That was the lie that we had to say to get in. I actually didn't want to be a professor at that time, but, Voldemort changed my mind. But I think the idea of careers outside of academia are incredibly important, and because more and more people are ending up in that area, and that means training faculty to be thinking outside of the box, encouraging students to do internships that are not research. So, a cognitive psychology person could be doing something at IBM, working on human factors. A biomedical person could be working at do an internship at a pharmaceutical company, or NIH, or all kinds of different, thinking about opportunities and then looking at the skills and how they translate. I think a lot of our faculty may not have that ability to think like that. And and then the other part would be bringing in alumni who have done that to talk to students about those options. I think graduates sometimes feel they're the black sheep if they have pursued that. I've been really lucky that my mentor, he has considered me, he talks about my experiences to the students in my program. So I think hearing that there are alternatives is very important.
Okay, if anybody has, okay, Dr. Kaplan.
Hi, well, thanks for the panel. This is the question I asked the last panel, so it's not a new question, it's just kind of repeated in a different way. But it's related to what all of you were saying, and that is that approximately 50% of the graduates of our PhD programs now, we produce about 50,000 PhDs in the US each year, and about half of those people are not going to work in academia. And PhD programs, for the most part, are just designed to produce new university professors. The last panel at the end, someone noted that she was trained as a social worker. And that's good, because social worker MSW programs train people for something quite specific, to be a social worker, or medical school trains people to be physicians. PhD programs train people to be university professors. And so my question is, are the programs doing the right thing if about half the graduates are going to go do something other than being university professors? And what should they be doing differently if we need to change them?
I'll answer the second half of that question. What should programs be doing? I think, research skills are very important. They can easily be applied to organizations and to other groups. So I think teaching us more practical skills like program evaluation is a very concrete skill that can be taught in graduate school. The reality to me is they're not replacing faculty jobs at the pace they were. There just aren't. The highest growth in academia is in non-tenure track, part-time adjunct employees. So maybe thinking in terms of advocacy about higher education not being run like a business. I think that might be another issue. But for graduate training, I would really think about skills that can really be useful. Think about the application of your field to other areas, and help students learn those.
Anyone wanna?
Well, I think just to the degree that training programs can provide, whether it be formal connections with kind of non-traditional settings, or at least the opportunity to not be present all the time in a lab, so that you can get that kind of experience. So not just all the ways that students are trained, but the different cultures that all of these different places offer. That a business setting may be different than something that would be more of a community organization. To get to know what are those cultures like, and am I a good fit for those different types of positions? And so that when you're done your training, if I'm not going the traditional route, what might be the best way to go, rather than say, well, if it's not academia, it's business, and then you realize you're not a good fit for business, and then what?
Okay, if nobody else has any comments or questions, this would be it. We really appreciate, and please, let's thank our parents. Thank you. And now comes the next part.